During the earlier days, the practitioners of speech pathology were much engaged in the activity of taxonomy, which is the naming, defining, and classifying various types of communication disorders that fall within their scope of practice. A committee set up in 1927 by the American Speech Association dedicated its effort and time to come up with a logical scheme to coin several new terms of speech disorders. The listing of the classified speech disorders was quite extensive and used mostly Greek and Latin-based terminologies. However, as years passed, these terms have changed considerably and are now being replaced with English phrases. Some terms have remained the same, such as dysarthria, echolalia, and dyslexia. However, others are now called by a different name. For example, dyslalia is now known as articulation and phonological disorder, dyslogia as pragmatic disorder, and dysphemia as fluency disorder. Back in 1942, during World War II, services providing to military personnel suffering from hearing impairments due to injury and shock from the battle increased, and this led to the term audiology being coined. The increased number of soldiers experiencing hearing losses and speech impediments led to a higher need of these services. As a result, more funding was directed towards the upgrade and advancement in these areas of practice. From then, audiology was considered as an established area of professional specialization. Over many years, the profession of speech pathology and audiology has transformed due to trends, social movements, and the development of technology. The use of computer technology to enhance the scope of practice includes cochlear implantation, augmentative alternative communication, and the specialty of swallowing. A speech pathologist, also known as a speech therapist, has many important roles and activities that they must partake in. They offer services to people with communication and swallowing disorders. These services include clinical services, which involve prevention, screening, assessment, consultation, treatment, documentation, and other crucial work related to their career. Although speech therapists are autonomous professionals, meaning that they are permitted to work independently with no supervision, they are often working alongside other professionals. For example, certain communication disorders are caused by auditory problems such as hearing loss. Having an expert who's experienced in dealing with ear issues, aka an audiologist, the work of a speech pathologist becomes easier and more fruitful. There is a wide variety of settings where speech therapists can offer their services. One can simply set up their own private clinic, or they can choose to work in hospitals, preschools, universities, and even in the homes of the clients.